The South African National AIDS Council warns against focusing too much on curbing COVID-19 at the expense of other health concerns. The council, chaired by Deputy President David Mabuza, is also concerned about the sale of alcohol under Level 3 lockdown. To discuss this further, we're joined by the councillor, Nogoduka. Very good morning to you. Tell us more about your concerns. What's happening at the moment?
Thank you very much. Good morning to you and good morning to your viewers at home. As the council, we are concerned. We've just received data that is telling us that provinces that have high COVID-19 incidents, and those are the provinces that would observe the lockdown regulations quite stringently, have decreased in terms of number of people living with HIV and people living with TB that are actually collecting their medication in the health facilities. This is quite a concern for us as the council. As you are aware, South Africa is one of the countries that are having a very high HIV prevalence. And as the country, we have made strides in terms of responding to the epidemic. Though we were falling short in terms of meeting our targets, you would understand that currently we've got about 7.7 million people living with HIV in South Africa, with about 4.6 million of those currently on treatment. So we still have a gap in terms of ensuring that everybody who requires treatment is on treatment. During the COVID-19 response, we then have noted that even the 4.6 million people that are currently on treatment are not collecting their medication as they are supposed to in the facilities. So our concern is that while we are fighting the battle against COVID-19, we do not want to lose the gains that we have actually made in responding to HIV. We want to make sure that all people that are HIV positive and on treatment, all people that have been diagnosed with TB and are on TB medication are collecting their medication, because our health services remain an essential service during this time. And also we have worked with the National Department of Health to ensure that even if you are not in the province or a district where you normally collect your medication, wherever you are locked down across the country, you are able to collect your medication.
And
the department has
also
made
a particular reason they're not collecting it? Is it a fear of exposing themselves to the virus if they go and collect it?
Yes, there are multiple issues that have come up. First of all, you remember during the lockdown regulations, the movement on restriction was then implemented. And as you know, in terms of how our health facilities work, you would not get a letter or get an appointment card to say today is your appointment collection. So the security forces will then turn you back to say you are not allowed to be on the street. As a response to COVID-19, because it has overwhelmed the health system, so you'll find that COVID-19 response became a priority. Health care workers had to leave the health facilities and go and do a community testing for COVID-19. And in that process, you'd find that some of the health care workers were then suspected as having acquired COVID-19. Then the health facility will then have to be closed to be quarantined. And then it means clients are not able then to access the health facility to collect their medication. So the COVID-19 regulations, as well as the infection rates, have contributed to people being scared and people being anxious to go out and expose themselves while going to collect their medication.
Okay. Tell us a little more about your concerns regarding alcohol.
As you are aware, it has been well known that alcohol, first of all, is a drug. Secondly, if you use alcohol, your level of risk assessment is then reduced. Therefore, people then tend to, one, engage in risky sexual behaviors, and two, they tend to be violent. So we've seen increased levels of gender-based violence, increased levels of intimate partner violence during this time, and we are concerned that people will then, their inhibition towards risk will then be reduced. Therefore, they will be engaging in unsafe sexual practices. They would not be using condoms, and we will be seeing high rates of new infections, but as well as see unwanted pregnancies post the lockdown period.
Okay, I really appreciate your time, Dr. Becker. Thank you.